Nigeria, Africa's most populous nation, has one of the largest healthcare systems on the continent. However, despite its vast population and abundant natural resources, the country faces significant challenges in providing quality healthcare to its citizens. Poor infrastructure, inadequate funding, brain drain, and a struggling insurance system have made access to affordable and efficient medical care a persistent issue. For a discussion around this, we're now being joined by Imasogie, the Chief Executive Officer of Avon HMO. Good day. Good to have you with us.
Good afternoon, Ian. Thank you for having me.
Very good. So let's look at this. According to a report by the Nigerian Health Insurance Authority, 10% of Nigerians currently have health care insurance coverage, just 10%. So these numbers seem to be low in a country of over 200 million people. Some say this is a sign of progress, but others are a little bit skeptical. Where do you stand on all this?
Okay, thank you very much. Before I go into that briefly, Avon Healthcare Limited has been Nigeria's most trusted HMO since we commenced operations in 2013.
Yeah.
Dr. Mrs. Awele Elumelu, OFR, sits as the chairperson of our board, and our mission is to empower people across Nigeria to live healthier, fuller lives by providing access to quality healthcare services. We are one of the healthcare businesses of Health Holdings, and Health Holdings is an African proprietary investment company committed to improving lives across Africa by investing in key sectors that are transforming the continent. Now, to your question on the 10% coverage, that number tells just half the story. Coverage has actually doubled. Before 2022, when the NHI Act was enacted, making health insurance compulsory for Nigerians, coverage was reported to be around 5%. Today, coverage stands at 10%. That's a 100% increase over a period of 3 years compared to the period between 2022 down to 2005, when Nigeria's health insurance journey started with the NHIS, as it was then called. Avon HMO also has been at the forefront for advocating for a new legal reform and regulatory reform. And we were quite excited when the Act was enacted in 2022. And we must give kudos to the previous administration for enacting the Act. And I must also commend the current DG of the NHIA, Dr. Kelechi Oiri, for the dogged implementation that has led to this resurgence so far. Yes, about 90% of Nigerians still wake up without health insurance cover.
True.
But the broader story is that of progress and can only get better. We are optimistic while being reminded of the challenges ahead.
Very good, Osa. Now, could these numbers, well, we do say it's still 10% or thereabout, but is it due to Nigerians not being aware? And what can private and public sector players do to improve these numbers, you think?
Okay, as a private sector player, I can say over the last 12 years, Avon HMO has invested significantly in awareness initiatives through traditional and digital media platforms. And that is not just from a marketing standpoint.
What has the response been in that regard?
Well, today, in line with our mission to enable people to live healthier, fuller lives, part of the equation is buying a health plan. And without education, people cannot buy. Then also, we have reached over 100 million people consistently annually through our digital media platform alone. And I believe other players in the industry also have similar stories to tell because cannot do it alone. But I believe that there should be a joint and shared commitment between the private and public sector to champion mass awareness initiatives in a way that educates people and also builds trust in the system.
Very good. Now, so other than awareness, health insurance still looks like something for only people with considerable income, as it were, or employers who can only pay on their behalf. So how is Avon HMO tackling this challenge, you think?
Well, access is still a challenge, and Avon HMO was the first HMO to launch health plans for individuals, enabling anyone not under government or private employment to buy health plans. We were also the first to enable people to buy plans online through our through our website. And we have continued to expand access through other platforms like WhatsApp chatbots, mobile app, and also our online marketplace partnerships. We also have customized plans where individuals can choose or select from benefits that they want and to get the coverage that they desire. And for as little as 65,000 naira, all our plans were created for affordability. So for as little as 65,000 naira, you can get our basic plan, and it covers outpatient services, it covers chronic conditions, even admissions, and it even covers surgery. So these are some of the things we are doing to expand access to healthcare.
Indeed, and technologies help you out in this regard. Now, trust remains an issue many Nigerians still see, when it comes to health insurance as, unavailable or unnecessary to a large extent. How do we begin to change this perception, improving on trust from whatever HMO you choose, and yours as well?
Well, I think we need to change religious and cultural mindset. Most people still believe that they don't buy into the idea that you need to plan in advance for illness. And that needs to change, because what you notice is that people believe that this is not my portion mentality, that syndrome. And we think we need to move away from that syndrome. We need to begin to educate people that you need to buy a plan and be aware that you can fall sick, so you get the necessary cover. Also, there needs to be a lot of education, because health insurance is one insurance that people buy and they expect to use, unlike normal general or traditional insurance. And so when they try to access care and they cannot, because maybe their benefit limits are not covered, or if they don't fall sick, they assume health insurance is scam. No, health insurance is not a scam. It's actually a security for financial shock. And so that's the message we need to begin to drum to the populace, that health insurance is not a scam. Then again, you can also look at health insurance. We need to also reframe it from being optional to being a priority, because health is wealth. And without health, good health, you cannot go to work. So the whole conversations around health insurance need to move away from it being optional to it being a priority. We also, as Nigerians, need to see health insurance not as a luxury, but as a safety net. And again, we need to move away
from that mindset
completely from a reactive approach to health, and embrace health insurance as a proactive lifestyle choice based on prevention, especially early detection, then protection from financial hardship as a result of unforeseen medical expenses.
All right. Also, beyond the use of technology as creating that awareness, are there other means you reach out to your prospective customers, as it were?
Yes, we have a team on ground. We have agents, and we also leverage on technology. We understand. We use our mobile app, telemedicine, especially for geographically difficult locations, because today quite a number of people live in the rural areas where healthcare facilities may not be available. So that's how we are able to cover that gap.
Very good. So we've been discussing the challenges, about HMOs and, of course, accessibility for a while. Are there still opportunities, and how are they to be explored for improving coverage and access, just as you mentioned?
Okay, thank you very much. What we are doing in Avon, for instance, I'll tell you what we are doing in Avon to also build trust in the system. Today in Avon, we know that trust is central to, or service delivery, if you like, is central to building trust. Today, if you call our contact center, we take calls in under 10 seconds, ensuring our members get the care they need so that they don't feel stranded. What we also done, we also have issued a service pledge to our members, assuring them that hospital approval request will be responded to in 9 minutes or less. Then, in rare cases, very rare cases, when people pay out of pocket, they can make their refund request through our mobile app, and we make that refund in 48 hours. So these are some of the things we are doing to build trust in the system. And we also know that once you build trust in the system, it's a way to reassure Nigerians that you can rely on us. And for us in Avon HMO, health insurance is not just a policy, it's a promise of care.
Hopefully, promise kept as well. Also, all right, so let's look at, we've often said that care is a collective responsibility. What's your message to everyday Nigerians when it comes to, owning their health and preparing for the future?
Well, my message is preventive health is still the best form of defense. You don't need to be sick before you prioritize wellness. Buy a health plan, go for that checkup, talk to your health provider. Good health is a personal responsibility. You have to own it. And at Avon HMO, we are here to play our part. But your health actually starts with you.
Yeah. All right, also, when you mentioned healthcare provider, what is the synergy like between HMOs and healthcare providers? They are the last frontier when it comes to delivering, the product to the patient, as it were. You can give yours as an example, your company.
Okay, for us, we are managed care services.
Yeah.
We do not provide direct services, healthcare services, that is, to our members. So we leverage on healthcare providers, be it optical, be it dental hospitals, to provide healthcare need to our members. So what we do, we are constantly engaging providers, and we are also giving them a promise that whatever claim they incur on behalf of our members, we pay between 3 to 5 working days, because they are the last line in the service chain. Yes.
So in view of all these services, what comes to mind as the most recurring, health problems that your company has had to, undertake in terms of health coverage, as it were, that is most prominent with Nigerians?
Well, I would say today access is a huge problem in terms of affordability.
True.
So most Nigerians are not able to access or afford health plans that can cover the whole bouquet of health services. So most times they try to access benefits that require higher limits, and they are turned down. There's always a challenge with that. So that is what we face most times, and they say HMO is a scam. But we believe that people should read the terms and conditions before you go into it, and they should be adequately educated and informed.
Okay, to a large extent, would you say, HMOs have, delivered on the promises of what product they have to the final consumers, as it were?
Yes, I would say HMOs have delivered to a large extent, but there's still room for a lot of grounds to cover. There's still opportunity out there, and I just believe that there needs to be mass awareness, because as a people, we will not come to accept HMO. We look at the coverage, 10% is quite low compared to other climes where coverage is going over 90%, some even as high as 99%. So there's still a lot of grounds to cover, but we're getting there.
Hopefully we'll see an uptick in HMO, prevalence in
Absolutely.
Nigeria, sir. So, Osa Imasogie, CEO of Avon HMO, would like to thank you for being part of the show. It's good to have you with us.
Thank you so much.